Hey Mo,
Ricky?
the doctor is in.
Yes, we are. And it is a happy Wednesday. It's beautiful. Great weather, good energy. I think everybody's feeling high because of the nice, spring is finally here. And it's a good time to talk about mental health. May is mental health month, right?
Mental Health Month. I know my azaleas bloom this week. I love when my azaleas bloom. They only last a hot minute, but they're so beautiful when they're here. But today we have one of our favorite people, and Dr. Wendy, who's going to make us all have a clear mind
Yeah.
and a pure heart and just feel at peace, right?
I love
That's right.
Because our peace is non-negotiable. And so we're so glad you're here today, the first day of May, to talk about mental health and how to I kind of think I called the episode, our checkup.
Ooh, that's a
Yes.
good way to put it. And it's a good
Checkup.
time to check in, check in and
Yeah.
check up.
Yeah.
Wow.
Yeah.
Dr. Wendy, welcome always. And tell us your why. Like how did you get into oncology, nursing, nurse practitioner? Like give us your story and that we'll start
Yeah.
from there.
Yes. Well, I'm excited to be here with you all as always. You two of my favorite people. So my name is Wendy Garba-Mayo. I am a nurse practitioner. I've been in healthcare for over 20 years, majority of that in oncology. And I developed a passion for oncology right in nursing school, my first clinical. I remember my first patient, African American man with metastatic pancreatic cancer. And I just felt so honored to be in his life at that time where he was struggling, 11 kids, but no one was there but me and him, and just really talking about his life, things he did, his regrets, where he was going, how he was getting there, his last wishes. And I just fell in love with that. And after that, I was on a mission to become an oncology nurse. And really that experience helped me finish nursing school. Nursing school is very tough, but that man was always in my mind. Like I have to finish because I need to be on the unit taking care of cancer patients. So that's why I fell in love with it. And ever since then to now, I'm still in it.
Wow. 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 Wow.
Yeah.
Wow.
Yeah. And it's really like the relationship too. You build the relationship. It's also very scientific, right? All the medications, all the trials, the disease processes and education, but it's just so complex. And then as a healthcare professional, I'm able to streamline and simplify it for the patients and family members. So it's just like, it's just a nice mix. If that, it sounds so weird, but it is, it's a nice mix. You know what I mean?
Yeah, I
It's
do. And what's interesting is that when I trained I knew I wanted to be a surgeon. And it was always taught and sort of indoctrinated that it was very compartmentalized, right? Back then it wasn't integrated. It wasn't like this is your care team. It's like you got to find a surgeon, find an oncologist, find a radiation doctor. And it felt very sort of fragmented. And I never thought that I would enjoy the relationships. I thought I was going to be the skilled and excellent technician who found the cancer, take it out, see you later. I don't want to see you anymore. But I
Yeah.
actually love that. I love continuity. I love the relationships, and I didn't think that I would. So you're right, and I wish more surgeons really saw it that way, as opposed to just sort of transactional. Because patients can feel that, you know.
Yeah, because it's people, right?
yeah.
And connection and relationships is what really sustain us as human beings. And then when someone comes into your office or your OR with cancer, it's a life shift that's happening.
Yeah.
And for you, you're able to partner with them to be on that journey with them, which is it's a privilege. I always look at being a healthcare professional, especially in oncology, as a privilege. But like, how do you do it? So sad, but it's really a privilege and an honor to be with someone at that time in their life.
Well,
But relationships is
I
so
had
important.
I'm sorry, I had a nurse navigate, I mean, a nurse practitioner, kind of my navigator when I had cancer, and they sent me to her, and I didn't know what that was, right? And and after she went through all the stuff, she's like, "Well, would you like to see a psychiatrist?" And I'm like, "I never had therapy before. I never saw a psychiatrist. Is that going to help my cancer?" And it was one of the best things I did. And to see a psychiatrist and go to counseling, I had no idea um, how I was enabling people to be dependent on me, which was causing me stress that I believe caused my cancer. But she helped me figure that out. She also helped me figure out what my stress factors are and that my peace is non-negotiable. And
Yes.
I don't think I would have healed the same way without that input and that love around me. I think also my favorite person in all of my cancer care was my chemo nurse,
Mm-hmm. Mm-hmm.
you know, because I felt like she knew who I was more than anybody. She was the closest to me. She spent the most time with me. But I think that relationship that I built, you know, it's Nurses Month soon. I still have to I bake our cake on Nurses Day and send it to
Oh.
them. You know, still, this is now 12 years later. But I think that even as patients, when we think about the relationships we build with our healthcare providers, you know, I think we find, I mean, then our nurses are like the, you know, who they spend the most time, right? And give the most love. I think, you know, our doctors, like, unless they're doctors like Dr. Mo, you know, who goes out of her way to spend time, but most of them don't. They're in and out, you know.
It's true. Yeah, even if you, I wonder though, even if we had the time, would we all spend the time? And I think that that's the difference in our level of comfort in really engaging with people and being vulnerable in a space where we want to be the experts. We want to offer you the best, and we want to be the savior of things, and we want to make it better. Like people go into medicine to make it better, but you know, what do you do when you can't make it better, or when you don't know if a thing is going to work, or you know, you're just not feeling that relationship with the patient? And I'm sure you have some of those experiences too, because people come to see you for mental health. Tell us a little bit about your practice. Let's talk
Yeah.
about that.
Love your
So
practice.
yeah, collaborative cancer care. What is it? How did you start it?
Yes, so collaborative cancer care, we are revolutionizing mental health and oncology. That's what we're doing.
Kudos.
Just throughout my years of being in oncology, it's a huge gap that exists. And I'm glad that you was offered a psychiatrist, Ricky, during your care. But collaborative cancer care, it is a practice that is curated, cultivated, designed specifically to provide mental health to cancer patients, cancer survivors, caregivers. And our next phase is cancer healthcare professionals, because they also need therapy just because of the work they do. But it's a gap that we are here to fill. I don't know of any other practice that is offering specific mental health services, medication management, as well as oncology consultation and navigation to the oncology community. So we are here to really fill that gap and really educate healthcare professionals that mental health is priority when someone has a diagnosis or is in, you know, survivorship, or even family members. They're part of the team, and they also need mental health services.
That's
So
so
am I understanding you to say that you provide like support not only for the person going through the journey, but their family and their ecosystem, and then you provide support for other healthcare practitioners and providers as well?
Yep, in oncology. That's correct. That's
That's
correct.
so great. That is so great, because
Yes.
it's like belong what we're trying to do with leaders, helping the people that deal with the sick people deal with their issues, deal with their emotions.
Yeah, because as
So cool.
oncology providers, it's a lot on us too. We take a lot
Yeah.
on, you know it or not, we
Mhm.
do. And to really help you be optimal, you know, in your practice, you have to deal with your mental health issues as well, and come to terms with grief, ambiguous grief, right? That we have, unseen grief, you
Yeah.
know, we get so,
Survivor guilt that
yeah,
you
survivor
know,
guilt. Yep,
Yep.
all of
Yep.
that, all of
yeah.
that. So,
Well, you know what?
go ahead.
I was gonna say, today I had 3 calls with women who were just diagnosed. So
Mm,
not even diagnosed yet, who just found a lump. So it's really that's when the stress begins, right? If you I started thinking about what are the pressure points where you need mental health help, right? It begins when you find that lump and you say, what's wrong with me? Is something wrong with me? And that's when you start to immediately get stressed, right? So then you go through the waiting period of getting that mammogram, that diagnostic test, that biopsy, and all of that. So for some people, it's like 3 weeks of hell,
Yeah. Yeah.
yeah, yeah.
emotional hell before they get diagnosed. And then you get diagnosed, you hit with that thing, yeah, you do have cancer. Now what? So, I mean, the stress starts as soon as you feel something,
Yeah.
and it increases. But I think that time of waiting and not knowing is so horrible. 3 women today called me with that story. Like, what do I do? I can't get my mammogram for 3 more days. My doctor can't see me till next week. Can you help me find a faster way to do it? And then all of these things, all of these phases that you go through with this cancer thing are horrific emotionally. And I don't know how to tell people to feel better. I mean, what I mean? Just like, what are you gonna do? I know they're not gonna sleep tonight, even though I talked to
No,
them for an hour. You know what I mean?
Yeah,
no.
we're booking out MRIs 3 weeks in some places, Ricky.
Oh,
Like yeah, and some of that happened during COVID. I mean, you couldn't get an MRI, you couldn't get a lot of things, but even afterwards now, there's all kinds of radiology shortages, supply chain issues still. And imagine if you got to wait 2, 3 weeks, right, to get that MRI or you get that diagnosis. It's like go mode, and you got to use and reference all this information you didn't understand before, like how to use your health insurance, right? Like that whole
right.
process.
You
What
have
about
enough, right?
right? What about your vacation? What about your kids? What about the church? What about your family life? What about everything else? And it is the most stressful thing. I think, when they say the major stressors, Dr. Winnie, you can tell them better than I can, but major life stressors, right? Like cancer's up there. It's one of them.
Yeah, for sure. But even on top of that, before you feel the lump or get the diagnosis, I mean, life. Let's not forget about just
Your life is
just
there.
life.
Oh, I know stress of my breast cancer. I talk about that a lot.
Yeah.
No,
Yeah.
I know. I
Yeah.
know.
Life.
Yeah.
Yeah, life is definitely just stressful, and finding a lump or having a breast cancer diagnosis is just on top of all of that. And I think, that's why we're here. You don't have to wait alone because a lot of it's the unknown and really talking about your feelings and what you're feeling, what you're not feeling. So even Ricky, what you're doing, even they can even call you. That's really good. That's an outlet, but people are looking for that. And I also think it's important for healthcare professionals if someone comes to you with a lump and you're scheduling an MRI or a biopsy or what have you, connect them with someone. Don't let them leave that office by
Right.
themselves.
Right. They
Connect
shouldn't leave it
them.
alone. Yeah.
Yeah.
Easy.
Yeah.
Yeah. You
That's
definitely
why
have to.
help. Yeah.
Yeah.
And be like, you don't know you need that help if you've never
Right.
done therapy before, had counseling, right? You don't know you need it. And
Absolutely.
so that's where that, thank God someone offered it to me. And I think we don't even know to ask for it because the stressful life is our normal. It's our
So,
normal. We all just deal with it. As
yeah.
Black
Where
women,
did where did the stigma come from though? Like where did this whole, sort of stigma about mental health and about therapy, how did that happen for us? How did we end up here?
I think because people label it as crazy. And I think it's really important for people to understand that mental health and mental illness are two different things, right? So mental health is really your
Ooh,
mental
say that
wellness,
again.
your
Yeah.
emotions, how you're able to handle stressors, right? How you exist in this world, how you really how do you support your mental health? That's what mental health awareness is about. Mental illness is a diagnosis. If you have a diagnosis of schizophrenia, bipolar, anxiety, depression, so it's an actual diagnosis. And I think the stigma comes in when people say you're crazy, right?
right,
That crazy. But we have to really understand that we can't allow stigmas to be a barrier for us to
right, and
really,
right,
yeah, curating our mental well-being,
right.
right? And I always say that, as we exist in this world, especially with COVID, we have to be the trendsetters. So we can't let the naysayers or stigmas or what people think or get in the way of us really being whole and, reaching out for what we need to make us, whole and well, including therapy,
You know,
So
and maybe we need to change the name. Like to me, the word clinical trials is a horrible word. I wish I could change the word, right? To something else. I don't know what it would be, but what if we need to change the world, for mental health? You know what I mean? Like what could be a better word that would make people more comfortable with it? And I really think Black women now, because of things like Essence Magazine, because of Oprah, because of, sort of all these outspoken women now talking about stress, it's an okay thing for Black women. But I still think it's hard in the workplace. It's hard in the family. It's hard when you start talking to men about it. It's hard when you really just have to take some time away from work or whatever it is that you need, and you have to explain yourself. So I do think that there's a stigma, but I do think Black women are being, more open-minded about admitting that they have it and try. But then when they say, okay, I'm stressed, what do I do? Do they have the resources or even the wherewithal or the know-it-all to, they could call you, Wendy, you know what I
Yeah.
mean? That, and you talk to see a doctor. At what point do you reach an imbalance where I need help with this? I'm not bouncing back as quickly as I was a year ago or 6 months ago. Something's
Yeah.
wrong. My depressed state that I'm in right now has lasted 3 days, not 2 or 1.
Mm.
So
Yeah.
when do I need to make that call and say, I need help?
Where you're not able to be who you are or who you think you are. That identity we talked about before. But it's really having that self-awareness, like you said, bouncing back, right? If it takes me 3 days or 2 days or something's just not feeling right, right? I can't get out of bed. I don't feel like getting out of bed. That's not normal for me. But reaching out is when you're off, when things are not quite right. And we know. And it very interesting, there was a study done that showed that Black women in particular, depression shows up different for us. So many of us may be struggling with depression, not even know it. So it could be
Come on, what are the
irritability,
symptoms?
No,
imposter syndrome, insomnia, right? How many of us are suffering from these things? And that can be
Wow.
depression. And it will not be caught because one, many people are not assessing us for it, right? And
Wow.
two, those tools that we have to assess depression, you're not getting insomnia, irritability, imposter syndrome, or not feeling good about yourself on there. So we have to be really self-aware and dialed into ourselves to understand who we are, what we're feeling when there's a shift. And when there's a shift, you may not know what's going on, but do you have an outlet to really, let's talk through it, let's unpack it together to see what is it? Maybe it's nothing, maybe it's something, but do you have
Right.
that outlet to really explore it?
Right.
That's deep. I was watching Kerry Washington actually did an interview not long ago, and she was talking about her therapist and how she said she thinks she's been in therapy her entire life. And somebody said, "Oh boy, does that mean it's time for you to find a new therapist? Maybe something's not working for you." And she said, "Well, no." She said, "I have a coach for my body. I have a coach for my food." She says, "So my therapist is my mental health coach."
Yeah.
And
I love
that's
that.
for the span of my life, because I want to be I want to be a thinker and a rule breaker, and I want to take chances, and I want to redefine myself, and I want to do all of this under the guidance of somebody who can coach me through all of it, just like I have coaches for everything else in my life. So I don't view it as a failure of therapy, but I feel like we do. It's like it's a last resort, right? When we just
Last
can't
resort.
anymore.
Yeah, it's a
Yeah,
last
and
resort. Yeah.
right, it's that last resort. And I feel like if we, and the same thing with exercise, I think in some regard, when we look at sort of our healthy habits and behaviors, we want to change after something major happens,
Yeah.
right? When the we
Right.
mistake the maintenance for the cure.
Right.
I mean, how many strawberries does it
Mhm.
take to make a breast cancer go away?
Right.
But can we do some modifiable things all along that help us to, have a slightly healthier, and a better quality of life? So I think we got to flip the script on that. But that comes from patriarchy too. When you think about, hysterectomies and that word hysteria, right? And women being placed in asylums for menstrual health issues and stuff, like there's stigma that's been put on us. But then as a Black community, there's a whole faith component to it too sometimes.
Oh yeah, for sure. For
Right.
sure.
Right.
Yeah. And I
Mm.
really think it's people taking ownership of their health, their mental health and their physical health. People say, "Oh, I don't want to go to therapy." Well, who has to know you're in therapy? Like just do
None
what
of
you
their
need to do
business.
for yourself. You don't have to broadcast it, right? But go get some help. Go get some help. And many people know they need it, but they just, that stigma, like you were saying, Mo, but you really have to take ownership because no one can make you do anything, right?
Right.
You
Right.
have to make those decisions for yourself. So important. So important.
You really do. And you have to have the confidence to know that it's okay to make those decisions for yourself, to say,
Yeah.
I need this and I can do it for myself. And we're all quick to take an Advil when we have a headache.
Boy.
We're all quick to take
Mhm.
whatever we needed, some
Yep.
Flonase allergies. So
Yeah.
what's
Antibiotic, right? We want that antibiotic when it's a
right?
viral infection, don't we? We
Sure.
don't give me the pill, give me the
Yeah,
thing.
give me some
For
pill, give me
sure.
the pill. So
How do we
Wendy,
convince people?
yeah,
Yeah. Can
it's
you
okay.
talk about that? Like, have you seen anybody who came in and was really reluctant and then sort of changed their tune or found the benefit. I want to talk about that transformation that happens, because I want to talk about it from the patient perspective, but then I want to talk about it from the healthcare professional perspective too, because the retreat we're having this weekend was for healthcare professionals as well. And
Ah.
many of them registered and signed up? Right.
Right, right,
Very,
right.
very few, less than 10% are going to be doctors, nurses, social workers, and the oncology team, because it's like, we can't get people to own up to and to put themselves in that position of vulnerability. So talk
Right.
about that from the perspective of people who've been reluctant to see you, and then what happens?
What
Yeah, people
happened?
that are reluctant to see me, it really comes down because they don't know me, they don't feel connected. But it's really about developing the connection, really showing people that you care, genuinely care, like collaborative cancer care. The first thing that happens is you have a 15-minute call with myself, being an oncology nurse practitioner, to really just hear about what's going on. What are the stressors in your life, right? What do you need? Right? Because sometimes it's like, what do you need? And maybe it's just more education, more information. And that's what makes us a lot different. You're not just coming for counseling or therapy, because we do have social workers and marriage family therapists, but I'm an oncology nurse practitioner. So I do the navigation, I do the education, I do the other resources you may need, but
Yeah.
it's developing that connection, knowing that I care, that I'm there with you, I'm here for you, and it's genuine. I think that shifts people, and also educating them that, yes, this is a stressful time in your life, but prolonged stress can lead to mental illness, right? It can lead to the anxiety, the depression. It can lead to the insomnia, the substance. It can lead to all those different things. But people don't know that because we live in a state of stress. Like I like to call the cycle of stress. It's like our norm. And
Right, right.
until something happens, So I think it's really important for healthcare professionals to develop relationships with their patients so you can properly educate and advocate for them. Because you have a relationship with someone and they trust you, they're going to go for it. They're going to say, okay, yeah, I'll schedule a consultation, right? I'll do it, because I trust you. I'm in the best hands. But we have to really learn how to connect with people, especially our patients.
Yeah, I don't know what makes people trust you. But I think, like anything, it's like getting results. Like if you take a pill and you feel better, that's a good thing. Then, okay, I'll do that again. Or if I have a good therapy session and I feel better, okay, well, I'll do that again. So it's almost like, how do you get people to try it as readily to try therapy as it is to take a pill or to get help for anything, right? So I think that you build that because, okay, now I had a great experience with Wendy. I can't wait to go back again because she helped me cope with this.
Yeah.
It's almost like Dr. Mo, you're going to get the cancer out when, after my surgery, I'm going to feel better because you got the cancer out of it. So, I mean, it's like, how do you prove efficacy for whatever the activity is to make people trust and make it worth their while? And I think with mental health, it's harder because we're not seeking it. We're
Yeah.
readily seeking that Advil, but we're stewing over the fact that we feel really bad that no, we haven't gotten out of bed for 3 days. No, we haven't fed our kids. No, I don't really want to go to the kid baseball game. No, I don't cooking dinner.
Yeah.
Does insurance cover the mental health services? Because I'm sure that's going to be a question if we haven't gotten it yet, because people are now trying to figure, they're like, okay, yeah, you know what, I haven't gotten out of bed in 3 days and I haven't washed my hair and I just feel, but my insurance isn't going to pay for that.
Mm.
Oh, yes, your insurance will pay for it, and we take insurance at Collaborative Cancer Care. And even if we don't take your insurance, we will not turn you away, because
Wow.
that's what we're here for. We are here to really partner with you and ensure that your mental well-being is really whole. And we're here to work with you on the journey. So yes,
Yeah.
insurance, they will pay for it. So that is not something you need to worry about. And if you don't have insurance, you still don't have to worry about it, So,
Right.
yeah, so yeah, it's
So you're
very,
saying no excuses, no
Yeah, no
excuses.
excuses, no excuses,
no
no
excuses,
excuses,
no excuses.
no
And I
excuses.
always say it starts with a conversation. So just because you have a consult with me, it doesn't mean you're in therapy, right? It doesn't, we're
Right.
just talking, right? Just to understand where you are. I want to see you. I want to get to know you. I want to know what are your questions. I want to know what's keeping you up at night.
Yeah.
Right. Let's talk through those things. Because maybe you don't need therapy. Maybe you just need some education. Maybe you just need someone to listen. Maybe you just need, everyone needs something different, but it's just it starts with a conversation.
And people call me all the time and I feel like I am not equipped to give you counseling. I can tell you where to go, like whatever, but I think that just having you as a resource that I can send people to is what I think I do best. Like I can get this for you. I can't give you the help right now, but I can say a prayer with you. I can tell you what I know about the information, but I can't change your emotional well-being. You need help with that. And here's a coach for you, or here's a person for you. And I think that's where, as even blesties who are doing this work, do our best work by just giving you a connection to, here's a phone number to call right now to get the help that you need. Because I know I don't have that in, you know what I mean? I can give you a hug and I'm really good at hugs, but you need more than what I can give you. Like I can't take your picture. I can send you to Mo, like I can send you to the right place, but
I can cut your cancer out, but I can't cut out your depression either.
Right.
Though. So,
Right.
and I think people are really afraid of just coming undone. They're afraid of falling apart. And the number one excuse I hear is, I don't have time to feel sorry for myself. I don't have time to cry. I don't have time to deal with this, and I guess what's the response for that? How do you counsel people to consider counseling?
Yeah, so I had a caregiver who recently lost her mom, and she went back to work the next week. And I spoke to her after, and she said, I'm trying to keep it together. I said, but why? Let it go. Let it go. Don't try to keep it together. But that's the thing. We try to, keep things as normal, and they're not normal, but it's really giving people permission to let it go. Come in here and just be yourself. Cry, shout, think whatever you need to do, but do not think that, you have a cancer diagnosis or you have a loved one diagnosed with cancer and things are just normal. Things are not normal. You're entitled to be upset. You're entitled to have grief. You're entitled to cry, yell, scream, anything you want to do, you're entitled to that. But it's given permission that it is okay.
It's okay. It's okay to let it go. It's okay to ask for help, and it's okay to not give into it. But it's really hard though when you got to feed the kids and you got to go to work and you got to like figure it out. But I think also, and you brought this up earlier, Dr. Wendy, is people come to cancer with baggage.
Oh yeah.
I know I did, but I know we had a woman this summer who she was living in her car. Her husband put her out and she's doing chemo from her car. And we tried to help her, but that relationship was bad before she had cancer.
Oh yeah, sure.
Right. So the cancer came to a place of baggage already. And I think we're all living our lives doing the best we can, but I know that's what happened to me too. Like I had to change everything about my life, but I see that with so many women, and I see so many women, I'm not taking this anymore. I want a divorce. We see the divorce on both sides, the women and the men, right? Like, Delcher with 5 kids, God bless her. Metastatic triple negative breast cancer at 34. I don't need to live in this way anymore. So, and I see that, we all become badasses with this crazy disease, thank you God. But it's still goes back to what can you cope with, and what does that coping look like, and how does it feel? And we all have different levels of that and mechanisms for that. So where do how do you figure it out that, what, I need to get some help?
Yeah.
And what do you do? I'm sorry. I was gonna say, if your issue is more structural, right? If your issue is homelessness and food insecurity,
Right.
Talk to us a little bit about some of the resources and the connectivity and the navigation pieces, because I think some people are thinking that too. And somebody even in the chat and in the Facebook group is saying, she's got some of those issues, and I don't have insurance, or I can't access these things, or, there's life be lifing, right? So how does it all work together, I guess?
Yeah, so we reach out to resources for you. Whether you need financial help, if you need housing, we're there with you. So you're not alone. Yes, you're in the car alone, but we're working with you to help you. So that's how we do it. And we have different connections with different people, different organizations, and we're still building our partnerships to really help. But that's why we're in the business. I have to tell you a really quick story about collaborative cancer care. So about 9 years ago, I wrote a business plan in my doctorate program about the Sunflower Center. The Sunflower Center was a place that cancer patients and their families can come and get really integrative, which I'm thinking about integrative now, it wasn't called integrative care, right? So I wrote this business plan, put it away, did the analysis and all the research. And then this year we start collaborative cancer care. I did not start collaborative cancer care thinking about the Sunflower Center. So it was like just manifested. And I'm saying that to
circle.
say that
Right.
this is my life legacy. This is my legacy. This is where I feel totally aligned with purpose. I told you how I started in oncology. This is how I will end my life in oncology.
Right.
Is really helping build. And I'm not, I want to make it clear, I'm not a therapist. I have partnered with therapists who are cancer survivors, who have been cancer caregivers, right? And then I bring my specialty, right? But we make a great mix to really just wrap our arms around the oncology community, because it's a time in your life where you need that.
Yeah. I love that.
So it's really a manifestation of my purpose, my life purpose. So
Yeah.
you call me, we're going to partner with you. I don't care what insurance, we're going to partner. We're going to help you. And that's really what I want to get out, is that we are here to fill the gap and to walk with you on this journey.
That's great. So do you work with patients all over, or just in Connecticut where you are?
So we only take insurance in Connecticut, but we do have a program that we offer emotional support, more support, not therapy,
Okay.
to our cancer community.
Right.
And then even those patients who come in and they want therapy, who don't live in Connecticut, what we'll do is you still become part of the community and the group where you're able to get the support, but we will connect you with a therapist in your area, not just any therapist,
That's
right?
great.
They have to be a therapist who, they have oncology experience, chronic illness, something, but it's not just anyone. So we will connect you.
That's great. So you really can talk to anybody and then try to get them the help that they need, which is awesome.
Absolutely.
I just put your website in the comments, so people can reach out to you. Yeah, I don't know. It's still such a touchy subject, and I don't know why. Because I think, maybe when we do this again, which we will, we need to have a couple patients on who have gotten the benefit of therapy. Like, how did it make you feel, and how did it change your trajectory? Because I also believe that anxiety does not help you heal.
Oh, you can't. You cannot. When the body is under stress, and I tell my patients this too, because they're thinking, oh, I'm just doing a surgery. No. I need you to optimize every area of your life for true healing. If you're really going to heal from this, right? Because if your mind is not right, if your body's not right, if your spirit's not right, your body will behave and respond, and our lives follow our words and our thoughts. And healing has to start from somewhere else, not just from cutting out the tumor. But it's been really hard. I have to say, directing the cancer program, we've had a struggle finding oncology therapists, folks who specialize and who have expertise, because how is it different than a regular therapist? What are the unique needs, and how, so if someone's looking and they're like, okay, do I go to a regular therapist or an oncology therapist? How is it different?
It's different because our team, they understand cancer. They understand the journey. You have me there. I've taken care of cancer patients like yourself, those side effects, what questions to ask, right? So that's what make a difference. They have the foundation. Yes, it's therapy, but they have an understanding of what you're going through.
just the experience of like what does the cancer experience feel like and look like, and you can speak to that, which is, and it is, you know, it's a thing. I mean, I wish I could
It's
describe
huge.
it to people.
Because
Yeah.
it doesn't go away. It's not like you can get divorced and there it is and it's all gone. Cancer just kind of stays with you even after, you ring that bell and after you stop seeing all those doctors, there's a different kind of anxiety that happens. And I feel like people expect that there's going to be some magic point in their journey when they just feel better and be over it. And it doesn't quite happen that way, does it?
No, it doesn't. It doesn't. And you know what? It affects your whole family. I mean, so whatever
Talk
counts.
about it. How so?
Yeah, and you know, it's a family disease. So, you know, Amanda, my older daughter, she's 38, the mother of my 3 precious grandbabies. She had a prophylactic mastectomy. Like it's been 6 weeks now, right? And I think her biggest regret is she wishes she got bigger boobs, but I didn't realize the emotional strain it had on all of us that she and her sister could get cancer until it was gone.
Mm.
You know, and now it's gone. Like now she, you know, she has maybe a 1% chance of getting breast cancer now, which is like basically the best you can do. Um, but when that weight was lifted off of our family, our whole family, her dad, me, her husband, my mother, you know, like everybody, because my mother, you know, basically we had 3 generations, so she had it too. So to take that weight away, that was like an emotional gain. Can I say that? But we didn't realize the stress that it had on us, right? Until she did something about it. And she, you know, she's religious about her, you know, therapy sessions and just getting her through that whole exercise too. And then even on the other side of it, but it doesn't go away. I look at my fake boobs every morning and say, you know, it could come back. And when I talk to a blessee that's having a recurrence, it could be me.
Mm.
So it's always there, and it's always there for your people, right? So, you know, now, you know, you can do things about it, and you can, you know, but I think just talking about it with everybody and not having this white elephant in the room is necessary, you know. And I love that you coach you know, caregivers and everybody in the family, because we all have something from this disease. We all get something, and it's a, you know, it stays with you for life.
Yeah, cancer diagnosis, I mean, because we all belong to someone, right? We're important to someone in this world, or people, or
Right,
a family. And when you have a cancer diagnosis, it impacts the whole family.
right,
Mom, dad, wife, sister,
right,
you
right.
know, mother, right? And everyone may not know how to express that, but everybody's worried, right?
Yeah.
Everyone has an emotional response, whether you see it or not, to it. So it definitely impacts the family. So it is a family diagnosis, even though it's just one person.
Yes, a
Mm.
family.
And to your point about your daughter, when I think about people seeking therapy, I really think about them taking their power back.
Yeah,
That's how I see it.
I love that.
It's
I love
about
it.
you stepping into your power and saying, I'm taking control of this, right? I'm doing something, right? I'm not just in the bed, you know, anxious, worried, can't sleep, and not doing anything, but you're doing something about it. So it
Yeah.
really is taking your power back.
And empowering yourself. Like, I'm like,
Mhm.
how bad I'm gonna take it. And I mean, I think that's what Amanda did. Like, I'm in control of this. I'm gonna be, and we tell women all the time, be the girl boss of your health. Be,
I love that.
be the CEO of your body. You go be a girl boss, and you demand the golden rule standard of care. Treat me like you treat other people, like you treat your family, right? But we all have to get there, because a lot of us are stuck being victimized, especially when we're young. I see these young babies. You know, we had, you know, our little Natalia, who we just met, 24, triple negative breast cancer, you know, and she's actually a PhD student. She's changing her PhD to be about young women with young people with cancer, young
Wow.
Black cancer, because of how it affected her. So I mean, I think, you know, some people are getting it and are wanting to talk about it, and maybe they will help others, because we need to get people out of their fear. It's all fear of the unknown,
Yeah.
right?
Yeah.
Like, I don't know what this is going to do. I don't know, should I spend time on it? Should I spend money on it? What am I going to get from it? It's going to make me feel better. And then, oh my gosh, I didn't. It does. Wow.
Right. I
How
think the
sick-
caregivers have an extra burden though too.
Oh,
You
they
know, I
do.
remember, the caregivers in my family feeling a lot of emotions. Some of them are dutiful and glad to be able to be a caregiver, and for others, there's a resentment, there's anger, there's all these things that people feel like have no place in this. And I think there's a place for all of it. You mentioned something, Dr. Wendy, about, grief. I had a patient who was afraid to cry this morning, and she had a double mastectomy. I said, no, no. I said, this is the place, this is the time. It's okay to grieve that. She, no, no, I should be happy. I should be glad that, I've done the things I needed to do. But it's okay to also feel these other things that we don't always give space and give voice to.
Yeah.
Yeah,
Um,
absolutely.
Wendy, can you speak to the church element in this? Because a lot of women will say, well, I don't need therapy. I go to church. I believe in God. I have faith.
Yeah, your pastor is not your therapist. I don't think they were trained in therapy, right? There is a method to therapy. There are theories that are applied to therapy, right? In the progress. I think when you're at church, it's a congregation, so they're not
Right.
following up. They're not setting goals for you, right? They don't know you personally. Are you reaching those goals? Are you moving towards those goals? Can your pastor answer the questions that you need answered? Right? Yes, talk to God, definitely, absolutely. Faith, yes, definitely, very key in your journey. But you want to go to someone who's trained, a trained professional. Like you wouldn't go to a podiatrist for your heart, right? A foot doctor for your heart, right?
You go to a
Right,
dentist for your cancer.
right, right.
Right. Right.
You
Oh,
wouldn't
now
do
you
that.
preaching now. Go ahead.
But no, you wouldn't do that. So it's really understanding who's the expert and what you need. Yes, the pastor and church are going to speak to your spiritual well-being,
Right.
right? But
Right.
your therapist is going to speak to your mental and emotional well-being. So it's very important. And I want to say something because in terms of breast cancer, we're doing such a great job in medicine that we have so many more survivors.
Yeah.
They're surviving, right? The cancer, but mentally, they are just not whole or
Free.
well, so to speak. They're still
They're wrought
struggling.
with fear. They're
I
wrought with
have,
fear. They're wrought with fear. You
yeah,
know?
I have a friend who said she had a mastectomy, and she said everyone was so involved, calling her for appointments, going, to chemo, radiation, doing all these things. And after she was done, she's like, I feel like they just threw me away. I felt like they did, and
Um,
she's struggling. She still struggles a little bit, mentally with, this diagnosis, all the things she
um,
went through. But I
um,
think we have to do a better job as a healthcare community to really support our survivors because it's growing, the number's growing. And if you are surviving cancer, you want to make sure that, your mental well-being is good because it all starts here with the thought, the belief, the behavior, the action, right? So it all starts here.
well, your thoughts are going to dictate your behavior.
Absolutely.
You have to start there and change them.
Absolutely.
And even that's when we tell people the first thing I say, okay, just know that you're going to be okay. Believe that in spirit, and let's go to work.
Mhm.
Mm,
Right.
mm.
And part of the work though is your mental well-being.
It is.
I don't know whether we're talking about that enough. So
And it's not always knowing the outcome, right? It's not always
right.
having all the answers, but it's committing to that journey of being authentic. And I feel like that's the part that sometimes physicians and providers, healthcare professionals, we check at the door because we don't want to seem uncertain. We don't want to seem
Yeah.
incompetent. We don't, I had a woman say, I went to doctor, almost cried, and it made me wonder how competent they were because they cried. And when we hear things like that, it makes you feel some type of way, like there's one right way to be as an oncology, professional. And that's not the case either. So at what point do healthcare professionals come to see you? Is it usually after a precipitating event, or are some of them like, you know what, I need this for me too? Is that tide turning also, you think?
Yeah. So healthcare professionals, they don't think they need the help. But I could speak
They
personally.
do, but
I
they
can speak personally as an oncology healthcare professional. It's heavy. It's heavy because yes, I've cried with my patients, definitely, because we've connected. they become like your family, right? They become part of your circle. You become
Right,
part of
you
their
are,
circle,
yeah.
right? You know their kids, you know your mothers,
Right.
you know their family. They become part of your, but they
Right.
become part of you. So I think, we have to humanize that. We're human, right? We are, surgeons and nurse practitioners and doctors and nurses and all that, but we're human at the end of the day, right? We put our pants on the same, we go to bed the same. I mean, we're definitely human, but we also have an added value where we know some things, right? We can help you through some
Know
things.
what you're saying. So help me out, walk me through. I come to you as a patient and I say, I just got diagnosed with breast cancer. I'm freaking out here. I'm waiting for my whatever scan to come back, whatever. Help me out. What do you say?
Yeah, so I want to know how you're coping. Do you have any coping? First of all, do you have a community? Do you have
Mhm.
people around you? Who do you have? What do
Okay.
you need? Are you open to therapy? Right? Because
Okay.
some people are not open to it, or they
Okay.
want to call you back, which is fine.
Right.
Um, but let them know that I will check in. So I usually check in with them weekly or every 2 weeks if they're not like in therapy, just to kind of see how they're doing. But really, I want to hear their feelings. What are you feeling?
Hmm.
Right? And it's really just about listening. It's not really about giving advice. It's just really listening. Well, what do you need? What is the need there
Do you
for you?
think people can always articulate their feelings? Because I think sometimes we don't know what we need, especially if we don't really know what the solution could be. It
Mhm.
could, I'll never feel better. You know what I mean? Like, but I don't know that we always know what we need. And I think that's where, I mean, I think, Mo, you put some of the things in the chat. Can you sleep? Are you sleeping? Are you eating?
Mhm.
Are, you know what I mean? Are you not getting out of bed? Are you doing? I think that's where we can help people because we don't really know what the symptoms are. It's like, and the analogy I'll make is like side effects.
Mhm.
So when you the side effect page, it tells you you're going to lose your hair, you're going to get tired, you're going to get fatigued, you're going to get whatever, you're going to get nauseous, whatever. But when you talk to a patient, the side effect is I can't go to work. I can't feed my kids. I can't go to the soccer game. I can't whatever. And so we're thinking about it in terms of the impact on our life.
Mhm.
And I think that's where we should be able to that like to mental health. You know, if I don't feel like getting up today, if I don't feel like, you know, doing it, and maybe this is going to make me think about how to talk to patients differently. So thank you for making me think about this. But like I'm going to say, are you sleeping?
Yeah.
Are you coping? Are you doing? And you started saying this earlier, Wendy. Are you living your life that you want to be living?
Right.
How about this? What's the last meal, the last decent meal you ate,
Mm,
right? And you'd
mm,
be surprised what comes from that. When I ask that question,
right,
or just tell me about, who's important to you, who should be in this
right,
conversation.
That
right,
Have
community.
you
Yeah.
talked to your family about this?
right.
And a lot of times we have it because we're afraid that they won't be a support for us. And I think it comes from not disclosing, right? The less we tell people, then the less able they
Yeah,
are to show up for us. And we don't even know how to show up for each other because we're also used to being strong that we say, oh, you stop your
right,
crying,
right,
or you get through
right.
this, or stay strong, and all these things that maybe aren't as helpful. So how do you counsel the family and the ecosystem about
Right.
those things when one day they want support and the next day they want to be left alone?
Well, that's part of it. That's part of the process.
Mm,
It's not one way, right? Today I can, be okay with it. Tomorrow I may push you away, but it's the expectation, it's the education, right? It's the education
knowing
on
what, yeah,
what
knowing
it's
what,
going to be for that person, that journey, but then how do you respond? So being in control of yourself, that coaching is
right,
definitely important. But
right,
yeah, I mean, like, the sleeping, the eating, all that, it's like, that's what you need. So how can we honor that for you,
right,
And everyone is so different. Because
right.
sometimes it's like, I just need to tell you and then I feel better, right?
Yeah,
So
just getting it out, just getting it off your
yeah,
chest, talking about
yeah,
it out loud,
yeah,
you know, yeah, yeah,
yeah, absolutely. But I think it's important when someone is diagnosed with cancer to really assess who's in their ecosystem. Do
right,
they have a husband? Who are they living with? And really bringing them into the conversation, maybe separately if necessary, but then together, You know,
Right.
we have, you know, a husband, we have wives, and that's who they're talking about. I want to have a better marriage, but like, how's your wife coping with that, right? If they're not coping well and you're in therapy, it's still going to be some conflict there, right? So it's like, how do you bring that together to really cultivate that marriage, you know, for this man who has, you know, this new diagnosis of myeloma, right? So it's important that you think about that. As a therapist, as a healthcare professional, that it's not just the one person sitting on your couch or who you're on the phone with or, you know, on the screen. It's the other people too. You
So
have to
you sign up with your family, you know what I mean?
family
And
therapy. You can do that. Yes.
family therapy, or you bring somebody along with you to help you deal. And frankly, we tell everybody, take somebody with you to the doctor
Absolutely.
for every visit so that somebody can be writing down. Should be the same for this.
Mhm.
Somebody should
Yeah.
be kind of recording the tools so that you can walk out of there saying, oh, wow, here's something I can do to make myself sleep. Oh, wow, here's something I can do to make myself feel better. Oh, wow, here's when this happens to me, this is what it means, right? Which is
Yeah.
still new information for a lot of patients, right?
Yeah. Yeah. It's so much to be done. There's so much work to be done.
Yeah.
But I think at the end of the day, it's about us taking ownership, taking our power back, and really starting the journey and seeing what it is and navigating it, right? With someone or with your tribe. Who's your tribe?
Who's your
Yeah,
tribe?
That's what it's about. Who's your tribe? You're
Yeah.
not you don't have to do it alone. And sometimes we think we do, but we don't have to do it alone.
true.
You don't
Are
have
there
to.
any gaps in research that you see? Any interest in research studies or questions that you wish somebody would do?
Yeah, I wish that all healthcare professionals would do a mental health assessment or anxiety depression assessment on cancer patients
Hmm.
every
That's so
visit.
simple. Wait, you mean that doesn't happen?
No, it doesn't. No, it's not happening. Not at
Wow.
all.
Yeah, yeah, yeah.
I think that's the gap is that we have, you know, resources
Mhm.
out there, but one, we're not assessing. So two, we're not even thinking about connecting people, right?
Okay.
So I think we have to really change that culture and really understand. I always tell healthcare professionals, you've been doing this for 20 years, but this is like their first time, right?
Mm,
This is their
mm,
first time.
Right.
right.
So
Right.
you have to think
Right.
about what that means to that person. You can't lose your empathy. You can't lose that insight. But this is
Mhm.
life changing. You've been doing it 30 years, but for this person, this is day one, right? So I think the gap is us really assessing cancer patients in family units to see if they need mental health or emotional support and connecting them there. Knowing, I think if you're in an office, your office should have resources that you can provide to patients. Or like even for our practice, the healthcare professionals that we partner with, we say, go online and do a referral. We'll reach out to them because sometimes patients won't reach out. I know that for sure.
Yeah.
We'll reach out, put their information in there. We'll reach out. We'll make the first move. But that's the huge gap.
And I think that's what we need for someone to make the first move. Like I would never have done it on my own until it was offered to me.
Yeah.
I mean, because I wouldn't have known about it, you know.
Here's the thing though, you know, like I'm expecting you to say something about AI and this and that and innovative whatevers. And you know what? I asked you, what's the study that I wish that you wish people would do? And you said, I wish they would just ask. Like that's where we are with it. It's like so basic. Just ask and assess how people are doing and connect them to a resource consistently.
Yeah.
Like that's
Yeah.
where we started from here. And that
Yeah.
it shouldn't be a hard thing. It shouldn't be a hard ask. It shouldn't be a hard sell at all.
Yeah.
I don't know that doctors do that, Mo, though. I don't think my doctor asked me how I felt emotionally. You know, they said,
No,
or they ask you like, you know, what are your symptoms? They don't ask you how you feel, you
true,
know,
true.
what you do is
Yeah.
so, you know, the way that you interact with patients is so different because you care. And I don't know that I don't want to say most doctors don't care, but I don't think they know how to.
And I think their focus, their care is on something else. It's on a specific aspect of the thing that they know how to do and the thing they know how to fix, because so much of it feels unfixable to us. It feels a little bit out of control to us. It feels like I don't know what drugs are going to offer you, and I don't know how to tell you about the side effects, but here's the thing that I can do. You know, here's my hammer, here's my nail. and they're so hyper focused on that we don't think about the whole person, especially in the time that you have, you know, the time constraints and everything. And it's just so, it's a bit broken. And then we feel like I don't have all the resources. I may get a patient in to see an oncology a therapist and an oncology centered counselor in I don't know how long. They're
Mhm.
backed up and one of them's retiring. And so now it's like, well, if I ask, now I got to do something about it. And they don't have a resource.
Yeah. And I think, speaking to the doctors not being comfortable or, focusing on the area, which is great. But I think as a healthcare team, you have to build in that infrastructure, right? So the
Mhm.
doctor may not be the one to do it, but
Right,
maybe it's
right,
your
right,
infusion nurse, maybe it's the person who's checking you in, whoever, but
right,
build it into
right.
the patient journey, right? The
Yeah.
patient is coming in. I think you check in with the receptionist. The MA takes your blood pressure. The phlebotomist takes your blood. The doctor sees you. The nurse practitioner does whatever, educating you on symptoms. The infusion nurse giving you your chemo. No one is asking you. No,
I,
no one.
no one in that spectrum, how you feel. Yeah.
Right. That's a failure of everybody, right?
And
Because that
yeah, it
you're
is.
absolutely right. Yeah.
That's triaging your problem, right?
Yes.
Triaging your issues this should be part of the conversation. So,
It has to be.
we're going to tell our people, our women that we deal with, all of you lovely ladies that are listening and watching today, be a girl boss.
Yeah. Yes.
Ask for the care. Say, you know what? I do not feel good today, and I need some help with this.
Yeah.
And how can you help me? And if they can't give you an answer, then call us. As you know, we're here. We'll call Wendy and say, Wendy, can you help us? Or how can we help this patient? But I think that, again, we have to sort of take this on ourselves as patients, which I wish we didn't, but we shouldn't suffer. Like we shouldn't be suffering with anything. When you need help, ask for it and take it on yourself, ladies.
Yeah,
People.
and going in and asking your oncologist, do
Correct.
you have a therapist that I can see? Do
Right.
you have a support group I can go to? Like holding them accountable, taking that power back. It's your appointment, really going in and, that's what I do. I tell them, like, ask this, you
Be the
know?
girl. Be the girl
Yeah.
boss.
So,
Me.
having that person that can give you that information on what to ask is also huge.
It's
It's also,
huge. And also, it's okay to feel bad.
oh yeah,
Okay.
Mhm.
for sure.
We all feel bad.
Mhm.
This is not a happy place. This is not an easy place. It sucks. And there are really some really bad days in this process. You know what I mean? And if you have a headache, you're gonna take a pill. If you're feeling bad, do something about it. Call somebody. Ask
Yeah.
for help.
You're right, Ricky. I think we have to normalize that. Like it's okay to feel what you feel and not, so much of the language is about fighting and strength that we
Right.
don't all legitimize
Right.
I tell my patients, listen, only way through is through. And in that throughness, in that process of going through it, there's going to be some days where you feel super empowered, you want to put your pink tutu on and run down the street, and other days when you want to crawl under the covers and you don't want anybody to see you, and you don't you wish that things could be different, and all those feelings are valid. They all have to be valid. And I think you're right that we gotta start normalizing this, and it sounds like to me there's an opportunity for us to even create some assessments and do some work. Dr. Wendy, the American Cancer Society has these national roundtables. I'm on the one for survivorship. And we talk a lot about sort of what does that encompass, mind, body, spirit, and everything. But what tools and what types of assessments and how do we begin to implement these sorts of things, or give patients, Ricky, on the advocacy side, a
Yeah.
tool, checklist, a worksheet. Hey, listen, I did my emotional checklist, and here's what my worksheet says. This is how I'm feeling. Right.
We
We
need
can do
that. Yeah, I was gonna say, I think we need to come up with a worksheet, just like we have our Her Story worksheet. Let's come up with so Dr. Wendy, you wanted a project. Remember you told me that?
no good deed goes unpunished.
I know. So I'm gonna call you and we're gonna make a worksheet.
I love
And
it.
we're gonna put it on our website. So just like all the, we give all the symptoms of cancer, we tell everybody all about the all that stuff. So let's talk about the emotional health. Let's make a worksheet. If you
Love it.
check off 10 boxes, then you need to, and put your number on the bottom, put somebody's name here, here's who you call. And let's do that. So that's our project. You
Love it.
ready?
Got it. Got it.
People reach you. How can people find you? How can they follow you on social media?
Yes, so you can reach us, go to collaborativecancercare.com, and you can sign up for our newsletter and stay in contact with different programmings we have coming up. You can go book a consult and you know, you and I can chat just to see a conversation, just to see where you're at, what you need. Is there any way we can help? And on social media, you can find us at Collaborative Cancer Care. We're Collaborative Cancer Care across all social media channels.
I
Great.
love it.
At Collaborative Cancer Care, I'm putting that in the comments, so everybody has you.
Perfect. While you're doing that, I need to remind people that the show that is coming on next is a breast cancer survivor. She's a thriver. She's a badass. She's a podiatrist, and her show, Stepping Forward with Dr. D, is coming up next on Black Doctor. And we want you to watch, support, ask questions, because you know you don't realize how important your feet are until something's wrong with them. So we want to talk about all things foot care, all things wellness, health, beauty, and survivorship with Stepping Forward with Dr. D coming up next on blackdoctor.org. And Wendy, we're just so grateful for you being here and being part of our team and the advisory board. And you just your energy and your enthusiasm toward this is infectious and it comes through.
Oh, thank you so much. Thank you.
Thank you so much. And Dr. Fred is awesome. And
Yes.
we have Touch Care this weekend, our Touch Talk this weekend, 11 o'clock on Saturday Eastern Time. The flyer will go out tomorrow, and we have TNBC Talk next Tuesday. So if you need some Bless You Love, call us, and we're here for you.
There it
And
is. We hope it's been
do Mother's Day on Wednesday.
all right. Well, that's it. We got to honor the moms.
Talk to some moms.
Love it.
Awesome.
Well, we hope it's been relatable, reliable, real. It's what we do every Wednesday night here on blackdoctor.org. I don't know if we're one of the longest running shows or not, Ricky, but we're very thankful for the platform, for the opportunity to bring you this programming and to be in your homes and to connect, as Wendy said. We want to have that connection with you. So we're so grateful to our sponsors. And that's it. We'll see you next Wednesday.
Bless you, love. Bless you, love.
There it is.
Love you, Mo.
Love you. And congratulations, Ricky.
I know it's a big
Oh,
day.
yes.
I left my hat, but
See,
yep.
that's okay. I didn't want to shout you out, but we're still on the air. Everybody give Ricky a huge shout out. She getting married on Saturday.
Saturday.
That's
One
it.
more
She's
day.
married
Yep.
now.
I know.
Love it.
I'll be married next week.
Congratulations.
Take care.
Bye. Bye.